Good afternoon. This is Mohsen Qureshi with the KOHAN group. I am with Dr. Kevin Sadati, plastic surgeon, facial plastic surgeon with Gallery of Cosmetic Surgery and Aesthetic Lounge as my guest, of course, here. And we decided to do this webinar for all of you viewers to go and examine this wonderful practice for Dr. Sadati as a case study so you can learn about it. And here, Dr. Sadati.
Well, thank you, Mohsen, for inviting me to this webinar, educational. Hopefully, this is something that our fellow doctors in plastic surgery and cosmetic surgery industry can use to modify their practices and adapt to the new way of norm and create better patient safety. I'm happy to be here, and let's start it.
Actually, yes. Wow, what do we got here? We got a little glitch here. Yes. So you can find Dr. Sadati on Instagram at Dr. Kevin Sadati, and also on his website at galleryofcosmeticsurgery.com. And you can find me at the KOHAN group on Instagram and kohaninc.com. What we're going to talk about here is really, especially post-COVID, we're going to talk about, two of us, about importance of building materials, the actual engineering, architectural design that actually took to put into this building to meet patient safety, and the kind of experience psychologically that the physical environment can provide for the patient experience, and of course, transforming everyone's life who works in that environment. This is probably one great solution to prepare a practice that is responsive to the new environment, such as the post-COVID environment, which we all are so worried about it. Any building, no matter what size, it will take the operations and flow, of course, of the patient, either is in the examination, in the surgery center, or in the med spa, in the aesthetic lounge, if you will. That is one of the #1 things, of course, the operations and how you interact in the space, of course, and it takes a lot of architectural, plumbing, electrical, mechanical, and what type of furniture you have. We'll examine all of these things one at a time for you. And if you have any questions, please put your questions in the question and answer in there, and we'll be happy to respond to those questions. I see people are just beginning to come on the webinar right now. So we don't have just about everybody who signed up yet. So everybody is joining right now. If I may, just to start, this is a 2-story building, 4,400 square feet, at about 2,200 square feet downstairs and 2,200 square feet upstairs. Downstairs is the surgery center, and upstairs is the med spa. And we're going to go, and I will ask Dr. Sadati, of course, to explain his operations as how he actually is. I'm sure you've modified your operations within this, within both the surgery center and the med spa. This is your surgery center, of course. I put it out for you, so maybe we can talk about it, Dr. Sadati.
Okay, so here, my office in the past, patient used to come to the office and go sit in the waiting area and then be greeted by a receptionist and front desk area to designated treatment room. But post-COVID, we had to make some modification to meet the standards and patient safety as well as the staff safety. So we do, prior to patient coming to our office, we do consent patients or a test that make sure they do not have any symptoms, and they have to sign it electronic to send us. So in that case, we accept them. Obviously, for patients who are having a consult, first we look at their photos, they send a photo, and then I do a virtual consult first. And if they are a candidate, then we accept them to come to our office. But before they come to our office, we do testing, whether it's blood work, we do IgG, IgM testing or nasal swab or saliva test to ensure they are negative, because all our staff are tested and we are negative, and we don't have intent to bring any symptomatic individuals to our office. So as soon as they walk in, obviously hand sanitizers, available mask and so forth to walk in. Since everything electronically previously signed, they don't have to interact with anybody. They're not going to sit in the waiting area, and they go directly to the treatment room, whether it's for a facelift consult or they're going to the nasal endoscopy room where I'm going to see them for rhinoplasty, or they're post-op patients that they're going to be seen for post-surgery. And so let's assume that someone who had a consult for facelift or rhinoplasty right after the consultation, which is on the left side of screen in one of those rooms, they come out and they go to my consultant room, which is located in the same parameters. So they're not walking all over my office. In that room, then they sit down and talk with mask, obviously, nowadays, and discuss the financial and so forth.
So this is for a patient who already has an appointment with you, right? So
that's right.
What if I don't have an appointment, just walk in? As far as
that's not acceptable. So we have a lot of procedure and policy in place on the door. We say we do not accept anyone who does not have an appointment. We don't have walking. We never had one, and we will never have one. So basically, if decided to come and have a consult, first of all, they have to submit their photos first, and then do a virtual consult, and they decided to come in, they have to be tested.
Now, tell us about the testing. How do you test them? Do they test prior to coming, or how's that? For the surgery center, of course.
Yeah. Are you talking about the surgery center or a patient for consult?
Well, whichever. If I'm coming for consult, and if I have an appointment for surgery, both.
So we encourage our patient to get tested through their primary care or urgent care that all over my office nearby. There are many of them that they perform those tests, whether it's a nasal swab, saliva test, or blood drawn for IgG, IgM test. They need to get that done. But if they don't have any resources to go those in office, we do have a designated area that we do testing. And that takes about 24 hours to get response from.
Okay, so tell us about the operation. So today I have let's say, appointment for the surgery. And what are the procedures as I come in?
Oh, okay. So for surgery patient, obviously in the past, they used to come 2 weeks before their surgery to do pre-op. Now we do it 4 days prior. So because we want to test them the day they come in for pre-op. So we perform testing, and we do have rapid tests, and also we have swab tests. So we do the testing. Once we get the result and they're negative, they come into our practice. We take photos and we do all the consent, obviously electronic. They can do it at comfort of their home. They don't have to sit down and use our iPad to do it.
I see.
And then once they come in, obviously they come by themselves. The driver or patient caregiver are not going to come to our office. They're just going to drop them off and they leave. And the patients walk into our office and they will be guided by our nurse to go to the pre-op area, which is located on the right-hand side of the screen.
So they come here and they go right
here.
Yes.
And in that area, there is a designated patient. They change their clothing and so forth. There are lockers and so forth that they can put their belongings there. The pre-op, the IV is placed and patient will get ready. And once they're ready, they be taken to the operating room, which is located on the upper right-hand corner of the screen. And once the procedure is completed, patient will be transported to the post-operative or recovery room area. In that area, after the recovery is completed, we'll call the ride to meet the nurse at the door and the nurse will take the patient with the caregiver, obviously wearing masks, to via the ramp to the curbside and get on the car and go home.
Yeah,
And
you're
so
fortunate to have the second door, of course, for the patient
yes,
exit from the OR. So this really, this area, this entire area is your surgical area, which is all clean area, of course, mostly, of course, clean area, but that's surgical area. Okay.
correct. So we need to isolate things in a different way. You can run patient who come from consult to the surgery, so they're all isolated while they're all combined beautifully together, but at the same time they're isolated.
Right, right. Now, if I come in and I have an appointment upstairs at the med spa, can I come through here through the stairwell and experience that stairwell?
Unfortunately not. So in the past, you know, many patients walk through the first floor and they walk through that beautiful staircase and go upstairs because it has handrail. We don't want somebody constantly cleaning the handrail, and that's an additional task for our infectious disease control officers. We have 2 of them in place. So they're constantly cleaning the door handle, all the common areas, and as well as the medical spa, they have their own infectious control officers. So they're constantly monitoring and cleaning and so forth. So we don't let them walk through there. So in that case, we tell them to go to the elevator located on the right-hand side of the screen, and it's shown, and take the elevator to the 2nd floor, which is the next slide.
I'm about to go to the 2nd floor, but this computer doesn't let me. Here we go. That's the 2nd floor.
Now it does. Now we are on the 2nd floor. As you can see, there are 2 arrows. This is designated to separate the 2nd floor from the 1st floor, so people who can take the elevator to come to visit us on the 2nd floor. Now, medical spa, again, we request patients to have if they can get tested prior to their treatment, that would be wonderful. If not, we deploy a rapid test. They come in, they get the test done, and they go either wait in the car or walk around the beautiful Newport Beach area. Or if you're in the middle of city, they need to wait somewhere till test is indicated negative or positive. If it's negative, then they can come in, and prior to their visit, their consent is signed. Again, they have to have a COVID consent in terms of being asymptomatic, not having any exposure and so forth, and consent for the treatment that they already have planned to do and they're on schedule. So when they walk in, they're not going to sit around in the normal, beautiful waiting area that we had in the past. They're directly going to be escorted to the treatment room that they're intended, whether it's a laser room, they're getting profound and radio frequency, or getting facial done, or cool sculpting, or injectables. They're all going to be, providers are going to be in their own rooms, and they meet and greet their patients there. And as well as the payment, is going to be a link sent to the patient, and they're going to sign and pay the payment without going to our Clover to sign anything. So
I assume you have a lot of walk-ins for the med spa. Am I right or not?
Well, people don't just show up. We don't accept people. Our practice is in a way like most practices. Everything is on a schedule, and we don't want people just walk in there. It's not like grocery store. So anybody who walks in.
Because I know you have a lot of signage out here in the corridor downstairs where you have those advertisements. And
yeah, but those are to indicate our office is there, but we never had any walk-in, and we normally don't accept. Everything is by appointment. So even from past, we didn't accept people to walk in. They need to make an appointment. Obviously, we were not, if somebody walked in the door and they wanted to be, seen or have a consult, we accepted them. But with this current situation, we're going to have a little bit different criteria, and we have to be very careful.
All right. Now, I have one question, because that's really important, and that is about the operations, of course, because post-COVID, Are you going to see the same number of patients that you did prior to COVID, or what are the status now that you're opening?
I'm sorry, can you repeat the questions? I was looking at the Q&A, trying to, some people
Yeah,
have some
that
questions.
one.
Okay.
Yeah, I was wondering what's your operation as far as the number of patients you see now that you're going to open post-COVID versus before?
So the way I projected, it's going to be about 50% capacity at this point. I want to keep it at 50% capacity, not more, so we have sufficient time to clean the room, sterilize the common area and the treatment room, so the staff not overwhelmed and patients feel safe, and we take every precaution to prevent any infection. So maybe hopefully by end of mid-June, things lax a little bit more so we can increase the capacity of seeing more patients.
I would assume because of that you're not hiring anybody right now because there was a question.
Well, we're trying to hold on to our own dear staff that we do have, and as of next week, the medical spa, they're all going to come in. Even we're not at full capacity, but I'm going to pay them to be here. At least they can work on the protocols and do other things that, and then start the engine, as I say. You know, we have to take the necessary step to start this economy, whatever that sector is. I think if we are all careful and take necessary precautions and be aware that what is going on in the environment and prevent any spread of infection, I think we can have an operation at the same time we're running our business. Sorry, Mark.
Well, that's great. So I guess just that was a big issue for me, because that is probably the most that's the most people's question, as if at what capacity are you going to start practicing, because as you mentioned, you're not using your waiting rooms anymore, and basically you have a certain number of rooms, and there is no overlap, if you will. So, and besides the fact of getting all the blood tests and everything, all of that takes time and cleaning.
Exactly. So there are two factors that I don't think the capacity is going to be as full. One is obviously the operational obstacles that we have to deal with in terms of testing and a sterilization process, and having additional staff to take care of things. And I think secondly would be the economic strain that is being placed on many people. So I assume when there's no wedding or there's no a party going on and restaurants are not open, people are not going to pay attention so much to aesthetic medicine as much as before. So and this COVID took a toll in a very profound way on all of us. Even I opened my door fully, I assume, I mean, I project that it will be a while before we go to the full engine, all cylinders on and moving at a rapid pace. So there are those two obstacles. One is the operational obstacles, and the other one is economic strain on the individual.
Well, so now you see how important it is how you operate. Of course, this we were so fortunate to design your office and be a part of your dream, if you will. And this layout, of course, was layout for both floors per the operations pre-COVID, if you will. And I am looking forward to see the operations you used to have come back in place and things go back to normal the way they used to be, so people really can enjoy every inch of that space. And we have really great photos to show you. But besides doing that, we wanted to touch base on some of the architectural finishes, like which of course everything in this project was coordinated with Dr. Sadati, of course, and selected together, and the cleanliness and the sanitization, sterilization was top notch in this project. At the same time, the beauty was a certain factor. So there was operations, cleanliness and everlastingness, and of course, the way we can sanitize it. This is the clinical area, and we're showing you what we're using for the floor, so you can probably take this as a lesson. And maybe if you're doing your new office, you could use this material, or if you're remodeling, and let's say I've seen people have carpets in the corridors or things like that, you could change those quite quickly. Of course, this is all ceramic tile in the entire surgery center. This is your first floor, Dr. Sadati, of course. And of course,
Right.
the clinical area also, we have—
You mean the surgical area?
The surgical
area is laminate.
The laminate, that's it. But the clinical area, all of this is ceramic tile, of course. And we have a few photos, but the surgical area is all laminate and with the cove base, so it's easily cleanable. And as far as the finishes on the walls, the same way, of course, the OR takes a special wall and ceiling finishes for sanitization. But as far as the, of course, cabinetry at the reception desk, again, we have solid surface materials. We selected those like a KOHAN, which is a great material that's with a quick wipe, you can clean it up. And don't be fooled by this. This is no, like, it's not grout. It looks like a grout, but this is pretty interesting tile, glass tile we used. And of course, Zodiac for all of these materials are easily sanitizable. And we have an image of this. Of course. And how many people we have there, Dr. Sadati, at the reception desk? That's your front entry reception desk at the surgery center, downstairs.
Well, downstairs, the first floor, which is my clinical patient thing and also entrance to the surgical facility. So there are two individuals. One is the one that is basically checking individuals in, sits on the left-hand side of the screen, and there's another one on the right hand side that check individuals out. And as you can see, the KOHAN is white and it's easily cleanable and very modern looking without having any bacteria won't stick to it. The floor, as you can see, there are two different floor color, but there are ceramic. And the glass, the bronze smoke mirror are at the walls and the entrance area that's easily cleanable. So those are the factors that well thought after. And at the end and back, as you can see, there's a glass there also that's easily behind the desk that easily cleanable. So these were like 2 years ago when we were planning, we had all this in mind.
Yes. And now I don't think you're doing the checkout the same way you used to do before, right?
Yeah, it's going to be mostly checkout in the room that they're sitting, so
Yes.
we can clean and sterilize that room. So we don't want to increase the chances of surface interaction.
Of course, that is, so they come in here and that's the beautiful stairwell that takes them upstairs, of course. And this is actually the waiting room, which unfortunately they won't get to sit here, of course, because of the furniture, right?
So this design was based on pre-COVID, let's say. So these are all hard velvet material that is not easily cleanable, let's say, but from now on, I would recommend individuals who are looking into waiting area to use special fabrics. There may, like a leather fabrics or synthetic material. There are excellent materials out there that you can look into and incorporate into your waiting area so it's easily cleanable.
Right. And of course, as you see here, again, on the walls, we have a lot of stone pieces. Literally, this office is made as if it's easily sanitizable, easily cleanable. The bacteria cannot really intrude into any kind of material, of course, except this rug, of course. But if you think about it, everything here is easily cleanable. We go to the if you will, clinical area in the exam rooms, one of the exam rooms, and check one of the exam rooms with, in each exam room, we have cabinetries, of course, plumbing plumbing and electrical. So as architectural, like we said, they're a big deal. And the plumbing fixtures, we selected a lot of touchless plumbing fixtures. So we were proactive for being clean and not touch anything. And as you see here, we used the soap dispenser and faucets, of course, all with sensors on them. And the cabinet surfaces and if you will, this is an example of that, of course. The cabinet surfaces, again, is solid surface. All of these is easily maintainable and sanitizable. The backsplash is, again, glass mirror, which with one single wipe, I guess you can clean it. And tell us about the chair, Dr. Sadati.
So we utilize two different type of chairs for the medical. This is the first floor. This is Dexter model. This is a US made with special fabric, which is soft and comfortable for patients. And as you can see on the left-hand side, the hands for washing the hands, and also this soap dispensers are all touchless. Mm-hmm. And all the cabinetry with the push of a foot or elbow that they can open and close. And as you can see, I don't have any clutter. All my gloves and hand towels are hidden under the cabinetry. So right, I'm so anti-cluttering, and yes, you can see they're very clean. There's no excessive stuff on the, so you have to clean them and constantly think about it. They're all hidden. If I need them, I'll take them out and I put them back in.
And I think
so it's always clean.
If your office doesn't look like this and you have a lot of stuff sitting on the counter, I think you should get rid of it, because you can't really clean bacteria on things that are sitting on the counter. We have lots of photos. We know people do that, and we're not showing it here, of course, in this program, but I hope you can get rid of it. This room is really feels safe. And I was going to ask you later when we get to other few photos, I need some patient experience, of course, from you and share with that. But right now, if you look at this room, of course, the floor is easily cleanable, the chair, everything, you can wipe it and you're done. You're ready to go, of course. And we have a little video here.
This is our spa room. As you can see, we have two different ventilation. One is the HVAC, and the other one is in each room. I placed a automated suction, or
yes, exhaust.
It takes the air out yes, after each treatment. As you can see, those gloves are hidden underneath, so there's not glove boxes sitting on the countertop, ugly
or mounted on the wall, if you will.
Mounted on the wall. They're looking ugly, and it's not aesthetically pleasing. So as you can see, sharps are in the doors, and you look at the garbage for soil products. I just clean something and I dump it in there, and with my foot close it, so I don't have to touch my hand. Everything is automated. Even the temperature is controlled by my app, so I don't have to touch anything. You know, all the sensors for the light sensors are all automated, so yes, they're touchless.
I think we have a photo later on is coming on that you're showing it. Yeah, that one we can talk about it. Of course, you're showing it, and so the exam rooms are pretty much equally the same, furnished downstairs in the clinical surgery center, and of course in the med spa upstairs. They're very identical on the finishes, backsplashes, cabinetry, and floor, if you will. This is your consultation room, which this is one of the most beautiful rooms where you do your magic work and you diagnose and you talk to people about what they do. And of course, we have a few pictures in this particular room as well. We have a touchless mirror, we have wall tile, we have floor ceramic tiles, and of course, that's our touchless mirror. And we have a beautiful picture here where I assume the patient sits here, right, Dr. Sadati?
Yes. So that's this is my facelift consult room. As you can see, that's a touchless and sensor mirror. So I talk to them right across them, and once they are ready, I turn the swivel chair toward the mirror so I can show them their facial anatomy and discuss further how much improvement they're gonna get. And it's well designed, it's clean, it's not cluttered, and that it is it. And just very simple yet elegant.
I have a question coming in about what's the wall, and I just passed it. I didn't see the question, but I will respond to this question later on as far as the material. I just passed it, but I will certainly respond to that question when we get back to that page, of course. But again, this is your consultant consultant office, whom she actually sits here and consult the patients. And we have some products on the wall. Floor is the same as everywhere else, ceramic tile again, and baseboard is ceramic tile. And the back cabinetry here is all KOHAN and solid surface, same as everywhere else, quite cleanable, no clutter. But this is where you...
as you can see, I'm sorry to interrupt,
no,
but
no,
as
go
you
ahead.
can see, there is no printer. Nobody sees any clutter here. The printers are hidden in that cabinetry there. As soon as you touch the door, it automatically opens and the printer comes out so the staff can take their print and it closes out. So there's no clutter. I mean, I'm like Apple product. It has to be clean and very clean and yet very sophisticated. So
That's right.
my office the same way. It has to be clean. Everything is hidden, organized, so you can find it where you need to find it.
Yes. And so
there's a question here,
Mohsen.
They're talking about the wall made behind the exam chairs.
Yeah, go ahead.
They're talking about the walls. Those are. Can you elaborate slightly on the wall?
The walls on the, if you will, the walls on.
You go for the pictures, please.
Yeah, maybe we can look at it. The walls here are all stone, if you will. Like in here, we have, and we can respond to these questions after I will respond it, one at a time. But there are quite few questions here. But these are all stone, and they come in certain sizes. They're square shape, but we arrange them in different pattern and shape. But almost no grout joint whatsoever. It's tight. It's like less than 1/6 of an inch, and is very cleanable. And also they're asking if you have any issues with our automatic sensors. I think
again, it comes with the territory. If you buy good products, higher end caliber products that they're commercial products, they come with warranty, and also if there's an issue, we had one issue with one of the sensors that immediately was replaced. So you have to, when you use commercial products, you have to use good quality.
And also they're asking if you're wearing gloves when you do your consult, and you when you touch the patient's face, if you will.
So no, I don't, but this is what I do. I have hand sanitizer sitting on that little table you sit right there. I sanitize my hand. Obviously, these patients are already tested. So we do swab tests and we do saliva tests. I'm not gonna try to contract any disease here. So I'm protecting myself and my staff too. So those people, I mean, put it this way. In my opinion, 98% of people in Orange County are COVID-free. And maybe 2% they have, maybe, if. So most people are healthy. We've been in quarantine for so long. For us, it's almost 2 months. And the rate of COVID possibility is very, very low. But at the same time, if somebody tested negative, I've tested negative, they're most likely are negative. So with all that said, I sanitize my hand beforehand. I show their face, touch their face, and then immediately before I touch anything else, I will re-sanitize it so all the germs are killed immediately. So yeah, I mean, I have to touch the patient's face. If it's a nasal endoscopy, that's a whole different story. I have a shield, I have N95 mask, and obviously we do the test. If the test is negative, then you treat it like a normal person that is negative. I mean, we don't have to kill it. We just as long as the patient is negative, then you treat it as a healthy individual.
And of course, maybe later you can tell us, or we can answer this offline as far as where you order your tests and everything, or you can answer it right now if you will.
Okay.
But this is the pre and post-op, of course. This is inside the surgical area. This is where we have, this is the pre-op, post-op, and pre-op is right behind it, of course, and the nurse station is here. In fact, again, everything is in here is all touchless, of course. This is a picture of it, of course.
This is the post-op area, post-recovery area.
Yes.
The only place that you can see gloves are on the wall, and that's according to the guidelines by AAAHC that we're certified.
Yes.
So they have to be visible. Yeah, we can't hide the, as you can see on the wall, you have an ugly little sharp
yeah, and they have good reasons for, they have good reasons. They used to have good reasons for doing this, but I think they're going to have to rethink that simply.
Yeah. We can, again, that should not be exposed like that. So
right.
I have few ideas to kind of make that hidden.
Right.
But at the same time, yeah, this is a very small, I mean, this is one room operating room. We don't have a big major, like a surgical facility, but at the same time is AAAHC, which is one of the highest standard of outpatient surgical facility.
And as you see here, again, that's the floor, vinyl floor. That's the rolled vinyl floor with cove base. And of course, again, everything here is sanitizable, and cabinetry is the same as any other place. We're going to OR, of course, with our, we have few automatic doors, of course, including our OR door, so you don't have to touch it. Floor material is the same as it was in the pre-op, in the post-op, I'm sorry. And the cabinetries are the same. And this is an image of our OR. The floor is vinyl and the baseboards are rubber base. I mean, the vinyl actually goes up and coves, and it becomes the rubber base here at the corner. And tell us about this OR, Dr. Sadati.
So this is a OR that I always envisioned to build. So I want everything, again, clean and not cluttered. This chair is a specifically chair designed by a German company that specializes in high-end OR table. It's all, they have voice control and foot control operation. So if you want to bring the chair up and down, you can do it with foot and also voice activated, so you can move it. And also the lights are touchless at the top. We can control the setting remotely. That's the anesthesia machine in that corner, the laser, CO2 laser resurfacing. And as you can see, those cabinetries, the gray cabinetry on the right-hand side, they have all equipment in there. So they're not all over the place, it's cluttered. So as soon as we're done with certain equipment, like a liposuction machine or so, they go inside and they'll be hidden.
Yeah, when we were designing this with Dr. Sadati, of course, we did very detailed design work, which is needed for for spaces like this. So we designed all the cabinetries, and of course, Dr. Sadati gave us the equipment that he required in every room, and we had all the measurements. So we have a little reel that we can see as far as our OR concerned, as how it works. And of course, we have the washing station. I want to show everybody. We can go back, and of course, we got the UV light here, by the way. Let's look at this film.
So this is before I go to the OR. I'm just doing a little demonstration. So everything is touchless. The soap and the light you see, this is to And then as you see the dryers, hand dryers, so it's touchless. And on the left-hand side, as you can see, there's the light that's next to our, let me go forward. So that light, it bugs and any insects that are coming because the door are very close, that get attracted to that, and it will reduce any chance that any bug that can get into my operating room. So as I go, this is touchless, obviously, but I don't know why I put my elbow in there. But it basically senses your motion. And you come to the OR. If you motion, you see the surface. Please stop here. The surface, we have special coverage, silicone coverage on the keyboard that we can wipe it, so the bacteria or any dust cannot get into it. As you can see, it's very clean. There's no clutter going on. Everything in the cabinetry. If you move forward and look at the stuff here, please. So as you see on the table, there is a sheet, and that's basically Bovie conduction return pad. Normally, we have a pad that we put on patient legs or back to prevent any burn or any touching. Again, we have this that we put our sheet over it and patient lay on it, and it prevents any burn or any contamination of skin. So less basically exposure. So it's excellent thing I recommend. This is newer products in the market. And just one word you want to take from me to take away, stay away from cluttering. So everything's clean and organized. As you can see now, this is the foot controlled Bromba operating table. I don't have to tell anesthesiologist constant, oh, raise the table, put the head down. Everything is controlled by my foot, and it has memories, and I can put with my foot, and I can take it out, and at the end of thing, I put it back on, and we're done. And as you can see here, the suction, liposuction, and smoke evacuator are all designed to fit in that little cabinetry. So those are reduced cluttering. And you see, this is the crash cart. It's all inside the cabinet too. So the crash cart is not sitting all over the place and get tipped over, or that's how it works.
Well, that's great explanation of that beautiful OR. And just one thing, what was the name brand of that chair, that OR chair?
Bromba. Bromba is a
it?
German-made company,
Yeah.
and also I recommend another company that they make beautiful exam room chairs for your spa.
And also OR Light.
Oh, the OR Light. Oh, the OR Light is it's called Trump. Not Trump.
That's not forgettable. That's very
not
good.
Trump. It's Trump Medical.
Trump.
That's another German company that produces high end. It's very true light. Honestly, I've worked in different type of headlights. It doesn't generate heat, and at the same time, it gives the true light because of the system they have. You can see the true nature of the tissue.
Yes.
And also the chair, the exam chairs, I recommend Gariani. I don't have any interest in financial interest in any of them. Gariani chairs are excellent as well.
And of course, we will move on to the, I think we've answered just about all the questions, of course. And yes, we have also automatic doors. There are a few doors that aren't automatic, and probably if you had to rebuild this, we would make all of them automatic, of course. But the cost is sometimes prohibitive, sometimes, but sometimes it seems like not necessary really. But the main area in the surgical area, all the doors are automatic, of course. Now, as far as the bathrooms, again, we have, I think, few photos on the bathrooms as well, where we can look at the, as far as the finishes, of course, the toilet, the sink, the countertops, everything is touchless. Like we have all the faucets, again, soap dispensers, everything is touchless, hand dryer. automated flushing the toilet. And of course, this is an image of that bathroom, of course. And we have a little reel that we can play for you here, of course.
So yeah, so as you can see, this is the bathroom area.
And
The lights are all,
this is the,
lights are all automated. So that the one I'm pointing at, it's sensor for the fan. As soon as somebody walks in the room, the bathroom, the fan goes on automatically, and you can see there's the light on those, and there are several lights that they automatically go off, and there is LED, and it also saves the energy when people are leaving, and it goes off. So
you're actually explaining it, so
yeah. Anyhow, so I can hear it, but
yeah,
I don't think anybody. Yeah. Anyhow, so if you move forward, this is the bathroom. If you stop here, so it is designed when patients, I mean, or anybody who's sitting on the bathroom, as soon as they stand up, it automatically flushes, so they don't have to touch anything.
These days, the toilets talk to you. You can tell.
Yeah, and then as soon as you walk away from the bathroom toward the sink, the water starts running. So it's kind of funny.
Automated.
Some people said, "The doctor, your toilet is telling me I have to wash my hands."
Well, that's for people who forget about it, right?
So the water starts running, and then they use the soap to wash their hand. As you can see, I use certain tops, so the material of the fungi or things, it doesn't splash from the hole in the sink.
Yeah, one of the big issue for contagious diseases is the drain on the sink, and yes. This particular lavatory, if you will, does not have the drain directly underneath of the faucet, because this does not splash. So, and also the drain is not underneath of it. Now, if you have one of those that it's got the drain right there and you have the faucet right on top of it, be aware of it, because the bacteria is living inside that P-trap. And if you have two rooms back to back that they are connecting, the P-trap is connecting, that is also a 100% possibility that the bacteria from one room can travel to another room, and during the splash, it will come to surface and can infect you. So we suggest to offset those P-traps into back-to-back rooms using a splashless, if you will, lavatories, and do not directly put the faucet above the drain line and offset.
So it's a little offset.
Right, right. So that is pretty much what we recommend, of course.
So as you can see, there's no opening put in there's a hole there that you can put the paper towel in there. We're in the addition of adding hand dryer in there too, so touchless hand dryer.
Here is another example that we recommend: backsplash glass, backsplash Corian countertops, or anything that's solid surface doesn't have to be Corian. And of course, on the baseboards, if you have tile, definitely tile on the floor and tile on the baseboard. On the cabinetry, we recommend the aluminum baseboard, if you will, which 3form makes it. A company called 3form makes it, which that we recommend if, for sanitization, if you will. So as far as automatic doors, that was a question. As you see, we have these doors automatic here in the surgical center. This is our surgical suite, of course, right here. And that is the exit door for the patient after surgery. And these doors are all automatic for our patients. We use a lot of glass. And the question is, when you use glass, how to take care of the privacy. And we use film, if you will, and film design in different opacity. And that's very helpful by dividing the space, having light transfer through it, travel through it, yet it provides you the visual privacy. If you do a double glazed, a double wall with double pane of glass, which there are several manufacturers who make it for division of rooms, glass is very good material. Initially costs a little bit more, but its maintenance is almost zero, of course, after you install it. How about we go upstairs?
Okay, let's
And
do
this
it.
is the beautiful stairwell that we love to take to go upstairs, of course. And this is when we arrive in the static lounge. If it was pre-COVID, we would take that experience. Now, currently, we are not. And that is a view. Of course, again, the floor plan for the aesthetic lounge with the same finishes as we had downstairs, ceramic tile all over the place. We have a pretty good picture of it. As you see here, this office, this aesthetic lounge, basically everything is almost ceramic tile or stone on the walls, as you see, and on the floor. And of course, this is all steel, 81-inch iron steel, where you can easily wipe everything down in this entire office to sanitize and clean. There is not a single particle fiber, if you will, anywhere that you see that it can actually allow penetration of bacteria. So tell us about the patient experience in your aesthetic lounge, please.
Well, you know,
What you have heard?
well, people feel comfortable. It's like cozy. It's like some people tell me, oh, it's like a Four Seasons. You go in there and just you feel the luxury, but at the same time you feel comfortable and cozy. You want to stay there. So and they feel safe. Frankly, it's just they can see how clean and there's no clutter. This is how my office looks every day. It's not just for the picture. This picture. This is how. If you look at my back, this is my office right now. The way it looks is always clean. Low clutter. People just have a great experience going through the office and feel not only appreciate the artistic portion of it, which is important, but at the same time, it's safe and clean and easily cleanable, and I think it's very functional as well.
Yes. And then we go to the next image we have here. This is your beauty bar, of course, and that's the entrance from upstairs, and the waiting area, of course, for the aesthetic lounge, which is a totally separate business, but it's connected to downstairs, the same floor finish, wall finish, and of course, this is an image when you walk into aesthetic lounge on the upper level of this practice. This is what you walk into, of course. That's breathtaking. And I think it takes definitely the word of wow out of everyone's mouth, I suppose, right, Dr. Sadati?
Yes, there's definitely people walking there.
So I wanted to go back and discuss a little bit about the mechanical now. We've covered all the surface finish materials, and of course, I wanted to actually talk about the mechanical, if you will, mechanical stuff. So what I wanted to do, if you look at the surgery center here, we have OR is got positive air pressure, of course, in there, which I have here, of course, positive air and negative. We, in the surgery center, such as this one, we normally do positive pressure in the OR area to make sure that is a very clean room, if you will. And everything else in this office is negative pressure. In this particular case, in this design, we use the existing HVAC system, air conditioning system that actually came with the building, but for the entire clinical area and admin area downstairs, including also the aesthetic lounge upstairs, but we have a separate unit for the OR, if you will. So OR is positive and everything else is negative. I have a diagram I'm going to show you how we made that happen in case you decide to do yours. But that is how it's got to be done, where OR will be positive air pressure and everything else will be a negative air pressure. Now, before COVID, people may not have done this because nobody really was assumed to be infected walking into this place. Although Dr. Sadati has a lot of protocol, I would assume people who come here, they're pretty safe. But it is very much post-COVID, we recommend everything to be negative except the operating room, of course. And when you go on the static lounge, everything on the static lounge area would be a negative pressure. This will allow 99.9% of the bacteria at 0.3 microns to actually get out of the space. So it is very healthy and it is very clean. And it's very healthy, of course. And 99.7%, 0.3 microns, that's what it is. Of course, I was going to ask you, are you using any UV light beside the one we saw at the washing station or not?
No, that's one of the things that we're planning to implement on the ceilings. The lights are.
Yes,
so
yes.
we're going to have UV lights. Once the daylight goes off, the UV lights come on. So we get during the evening hours or closing hours, we get UV light radiation.
So what we got here, and I know we are almost toward the end of our presentation, but I wanted to show you this diagram. This is Dr. Sadati's project diagram for the HVAC system. This is the existing central HVAC system, which we inherited from the building. It was really nice system, so we kept it. But this is an example of what we did, for instance, in an exam room. If you had one of the exam rooms, we went ahead and we actually did a negative pressure by introducing a HEPA filter before the unit and one after the unit. So the air exiting the exam room goes through a HEPA filter to the main unit, gets cooled, and go again through the HEPA filter and comes back into the exam room. Of course, a negative pressure, it means that the amount of airflow that is exiting a room is about 10% more than the amount of air that's coming in the room. That's what it makes it a negative pressure. But you have to have swing doors or pocket door. That means you need not to have any leak, so it can actually perform. And there will be a sensor on the outside of the door where it shows and keeps the pressure. You can monitor the pressure to make sure it stays at the pressure you're requiring. So this is how we created the negative pressure for Dr. Sadati. And as far as the OR for Dr. Sadati for the surgery center, this is a dedicated HVAC system we introduced for the one OR, and where we have a positive pressure. That means there is 10% extra air, additional air coming in simultaneously as it is getting out. So always this room is positive and it's clean air and is healthy for the patient who is laying on that bed. And of course, this pressure monitor is there as well. And I put this for people who probably are going to renovate or they're trying to modify their existing office because they're not building a new one. If you're using a central HVAC system, which is probably the most feasible one, and you have one example, if you look up the ceiling, you'll see a register supply air coming in and one that is a air return, if you will, return air, if you will. It is not a bad idea to add a HEPA filter at either one of those registers. And what happens, and of course you can add a pressure monitor. The pressure monitor is about $2,000, and you can add, if you did one room, you could do several rooms with one, of course, pressure monitor. And the air can exit, negative pressure can exit, and of course goes through the system and then out and come back through the system. Of course, this is a negative pressure for the exam room. That means the air coming in is going to be about 10% more than the air is going on. With the existing air conditioning system, of course, because you're adding a HEPA filter, it needs more power. So you may have to add upsize the motor of the existing HVAC system and also add a booster fan, if you will, for the airflow to push faster. Those are small modifications you can do, and this is very feasible if you intend to do a negative pressure for your existing exam rooms or any other office you may have in your space. If you have one or two, this would be pretty efficient. If you want to do the whole building, I recommend to go and put the HEPA filter like we had it for on the previous, on this particular diagram. Please call me if you have any questions on this. We'll be happy to help you. This is some of the images on the HEPA filter that goes on the ceiling, as you see here and here. Of course, you have to have room above it, and you have to have, hopefully you have acoustical ceiling tile where you can access it above the ceiling. If you don't, then there are other issues. So every case is very different. And if you look at here, we can do, you can do portable. This is pretty ugly. You may not want to do that, but of course, I'm just going to, because we're out of time, so I'm not going to talk more about it. It's exactly 1 hour, and we're done with this webinar. Dr. Sadati, I appreciate your time.
Thank you all
thanks
for attending, and we had a full room and many attendants here, and that's amazing. And if there's any further question, you can direct it to Mohsen, or I'll be happy to answer your question. You can reach out to us, and wish everybody safe, and hoping the economy goes back to normal routine and turn the engine on and move forward.
Thank you so much. Have a great day.
Thank you. Bye-bye.
Bye-bye.